Welcome back to In Plain Sight. Now, this is part 2 of my COVID special, and in this episode, we're looking at the not controversial at all subject of vaccines. Now, I'm going to lay out the evidence and the facts as we know them, and as I mentioned in the first video, there is a supportive Substack long-form article that has additional references if anyone wishes to delve a little bit further or check the references, etc. I haven't put them in this video, but they are there available. If anyone wishes to view them and read the article itself, and the link for which will be in the comments. Now, no better topic that captures our age, really. To some, vaccines were flawless miracles. To others, they were genocidal poison. And you'll have all heard the, competing arguments that didn't originate because of COVID. They were amplified because of COVID. There's vaccine debates have gone on ever since vaccines were invented and then in widespread use. Now, I want to make something very clear. I don't believe that vaccines should be mandatory outside of certain situations. I don't necessarily think COVID fell into that situation. So I think there are some circumstances where there is a stronger argument for it. But generally speaking, I don't think vaccines should be mandatory, and I should think it should be an individual choice, whether it's yourself or whether it's your family. And nor do I think someone should be judged because they choose to have vaccines. All you get on social media now is everyone judges people who've had a vaccine. We're sheep. Maybe we're just sensible. Maybe we think we're sensible. Maybe it's just based on our experiences. Maybe as an infection control nurse, I thought it was really important for my kids to be vaccinated against meningitis because as an infection control nurse, understanding the science, having spoken to people, having been in that environment, I've seen what meningitis can do. I would rather reduce the risk of my kids getting it. But that's a personal choice. If someone chooses not to get their kids vaccinated against meningitis, I would never judge them for that either. It's an individual choice. You do what you think is best for you, and especially for your children, what you think is best. We shouldn't be judged for doing what we think is best for our children. I've been called a child abuser and all sorts because someone found out I'd had my kids vaccinated when they were kids. Since when did we live in a world where you do what's best for your kids and all of a sudden you're a child abuser? It's like, anyway, mind-blowing. However, I digress slightly. Let me just quickly interject here. I am not going to change the minds of people who are virulently against vaccines. I am not going to change the minds of people who believe it was a pandemic, in inverted commas, that it's a global conspiracy, that the government's part of a massive cabal trying to control the population. The people that believe the John Campbells and the David Icks, etc. I know I am not going to change your minds. And I'm not trying to. All I'm trying to do is put out, as always, an alternate take on what might actually be the facts and the truth of the situation. Back to COVID vaccinations. They were seen as flawless miracles or they were seen as genocidal poison. Both positions actually fail pretty much immediately because the truth is harder. Vaccines for COVID saved lives. Vaccines for COVID had side effects. Rarely very serious ones. And that isn't a contradiction. That is medicine. Every medical intervention carries with it a risk. The real question that we should be asking is, what was the balance of risk versus benefit? Now, an important question that always comes up is, did the vaccine save lives? Yes, fundamentally. The UK COVID inquiry Module 4 summary referenced an analysis estimating about 475,000 deaths were prevented by the vaccination in those aged 25 plus, approximately by March 23 in the UK alone. Now, the Lancet did some global modelling studies, and their infectious diseases report estimated that millions of lives were saved in the first year alone. Now, note carefully, that doesn't mean that every mandate was wise. I am not saying that every rollout and choice of a rollout and how to roll it out was perfect. It doesn't mean criticism is forbidden, but it means that the vaccines had meaningful population benefit. And that matters. That's important. Now, were there real side effects? And here's where trust was often damaged because some officials communicated too simplistically. Safe and effective is broadly true at population level, but many people heard it as zero risk. And there's no vaccine in the world that has zero risk. Now, recognized rare, but not never occurring adverse effects included myocarditis, pericarditis, after the mRNA vaccines, especially in younger males, and usually mild, but occasionally serious, and therefore did exist. And the CDC recognized this association. There was a risk in cases of thrombosis with thrombocytopenia syndrome linked to adrenal viral vaccines, namely AstraZeneca. And there were some allergic reactions and anaphylaxis, which you get with many medications and vaccines. That's just not COVID specific. That's just generally existing. And, foods and products just in general. Now, all of these should have been discussed clearly, honestly, compassionately, and there should have been full transparency. And there wasn't. And when people experience real harm and feel dismissed and ignored, distrust spreads far beyond that initial case. Now, what the evidence does not show speaks to louder claims. Vaccines were designed to track and control us. That's a popular one. There's no credible evidence. mRNA vaccines specifically deliver instructions for your cells to make spike proteins briefly, which triggers an immune response. That is not new science. That is established science for decades. They do not contain tracking devices. They do not interface with 5G towers. That was a good one that I was told. They do not rewrite your DNA. It's impossible. So that theory only really survives if the biology of vaccinations is ignored. Another popular one that I found personally assaulting because my beautiful mum passed away from cancer was that vaccines cause turbo cancers. There's no evidence at all supporting vaccines of any description, specifically COVID, causing cancer. Cancer diagnoses continue for many, many reasons: delayed screening, aging populations, lifestyle risks, genetic predisposition, improved detection, etc., etc. Claims of a secret epidemic caused by vaccine are not supported by any oncological data whatsoever, or hematological data for that matter. Millions are dropping dead. There was a doozy that you got all the time. Large-scale excess mortality claims are repeatedly misused online. Excess deaths are influenced by delayed care, cardiovascular disease, respiratory illness, aging demographics, heat waves, drug deaths, chronic disease backlog, yada, 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 not automatically caused by vaccines. Again, this is a leap of ideology pretending to be analysis. Now, one that really, really drives me around the bend is commentators and their so-called influence. And they do have influence, but it is misguided, dangerous, and wrong. People like Dr. John Campbell, David Icke, Brian Rose's, is it London First or London Free? Or Brian Rose, I like as a host, commentator, podcaster, presenter. Some of the guests he has on are ridiculous. There was a lady I was listening to this morning who was talking again about COVID, was deliberate genetically engineered virus to cull the population, but absolute nonsense. She's a discredited scientist. There is not one single thing she says in her claims that she has proven herself or has been proven by any science at all. Now, people can say, well, these people are just being shunned and silenced and discredited because they are right. Flip that on its head. Dr. John Campbell, for example, is correct. And billions of people in the world are keeping a massive secret, but he knows the truth. David Icke is in on this absolute global fact that COVID was a conspiracy of global proportions to cull the population and control us. Billions of people who've had it or work in healthcare or work in science or work in research know that that's true, but they're all keeping it a secret and not one person ever lets slip. Another important thing that I noticed during the pandemic, and I know there were healthcare detractors for COVID precautions, preparations, mask use, vaccines, etc. And I used to get people on social media telling me there's all these thousands of nurses on strike at so-and-so. In my 2 years working in the film industry, public health, the NHS, private organisations, I never came across, heard or spoke to a single healthcare professional who had struck, was refusing to do anything that they were being asked to do from an infection control perspective, refused to wear a mask, did all of these things that everyone on social media said was rife across the UK. I never saw it once. And I'm not saying it never happened, because there will have been people that didn't agree for a variety of reasons. But I used to say, well, tell me where it's happening, because I can't support what you're saying because I've never witnessed it. And all the hospitals I worked across, I never saw people striking outside. I never saw nurses walking off the ward. I never saw nurses getting dismissed. I never saw nurses getting suspended. I never saw them, protesting outside. Never. So I want to know where it occurred because I never saw it. And like I said, for those 2 years, I worked across a myriad of different healthcare organisations and never saw it once. So I used to find it fascinating. Were these things really occurring, or was it the old one person did it, but then it's multiplied by 3, that kind of thing? But going back to figures like John Campbell, they gain an enormous audience by presenting themselves as sober truth seekers and he performs alarming interpretations and selective readings of the evidence. And this is really important. You do not need to lie outright to be misled. They're not lying outright. None of them are. You can, in these examples, the John Campbells, the David Icks, the Brian Roses, the guests on, the Andrew Gold guests on Heretics, all of these people, the Katie Hopkins, etc., etc. You can omit context. You can overstate weak signals. You can spotlight fringe studies and imply certainty where none exists. And you can repeatedly ask loaded questions. And that makes the result feel rational. But feeling rational and being rigorous are not the same thing. Now, conversely, where critics were right, some critics have raised legitimate concerns about coercive messaging at times, poor empathy for vaccine-injured individuals, policy overreach in some settings, failure to explain uncertainties, tribal dismissal of concerns. That is valid criticism, and it absolutely deserves space. Because if reasonable concerns are ignored, unreasonable voices thereby inherit that audience. So you have to balance it very carefully, and it wasn't. COVID vaccines were not and are not perfect. Neither are they poison, they're not mind-control devices, it's not a global coal. They were vaccines developed at speed during an emergency with substantial benefits, real risks, imperfect communication, and political baggage attached. And bear in mind, COVID vaccines were not designed from the ether. People have been trying to find a cure for coronaviruses for decades because it's the common cold. This was a novel coronavirus that had never been seen before. But the baseline work already existed. That's important to bear in mind. They weren't just invented, out of the blue. So once again, it's important to remember, some people were wrong. Some people were half right for the wrong reasons. And some institutions told the truth really badly. And my job is to try and separate those strands, because that's how trust is rebuilt. And as always, I just want people to try and consider that sometimes the middle ground is a good place to see both sides of the argument, because often the truth is hiding in plain sight.